How to write patient problems and nursing diagnosis for appendicitis based on signs and symptoms. Appendicitis is the inflammation of the appendix, typically caused by obstruction or infection. It can lead to rupture if not treated promptly, often requiring surgical removal. 5 common signs and symptoms of appendicitis. 1. Right lower quadrant abdominal pain, often with rebound tenderness. 2. Nausea and vomiting. 3. Loss of appetite. 4. Low-grade fever. 5. Constipation or diarrhea. Writing patient problems using the presenting signs and symptoms. Abdominal pain. Writing it as a patient problem. Patient complains of sharp pain in the lower right quadrant of the abdomen. Nausea and vomiting. Writing it as a patient problem. Patient reports feeling nauseated and has vomited once since onset of pain. Loss of appetite. Writing it as a patient problem. Patient states, "I don't feel like eating," and has not eaten since the pain started. Low-grade fever. Writing it as a patient problem. Client has elevated body temperature, 37.8 degrees Celsius, that's is 100 degrees Fahrenheit. Constipation or diarrhea. Writing it as a patient problem. Patient reports changes in bowel habits, including constipation and bloating. Writing nursing diagnosis using the presenting problems. Abdominal pain. Nursing diagnosis. Acute pain related to inflammation of the appendix as evidenced by verbal reports of pain and guarding behavior. Nausea and vomiting. Nursing diagnosis. Nausea related to gastrointestinal inflammation as evidenced by reports of nausea and emesis. Loss of appetite. Nursing diagnosis. Risk for imbalanced nutrition. Less than body requirements as evidenced by decreased intake and anorexia. Low-grade fever. Nursing diagnosis. Hyperthermia related to inflammatory response as evidenced by elevated body temperature. Constipation. Nursing diagnosis. Constipation related to decreased gastrointestinal motility, secondary to inflammation of the appendix, as evidenced by patient's report of no bowel movement and abdominal bloating. Note: symptoms may vary between clients depending on underlying conditions and individual health status. For guidance in preparing patient or client-centered care study and care plans, comment "care study" below. Thank you for watching. Please subscribe.